Now, if you see the classification of the drugs, right, if you see the classification of the antineoplastic agents, if you take this classification, let me tell you broadly what are the various classes of these antineoplastic drugs. They include, number one, alkylating agents, right, they include what is called as the alkylating agents. Then we have what is called as the platinum compounds, right, then we have what is called as the platinum compounds. Next to the platinum compounds, the other group of drugs what we have is antimetabolites, right, antimetabolites. And next to the antimetabolites, what we have is the natural products, right, the other group of drugs what we have is the natural products. And the other group of drugs, if you see, the hormones and related agents, right, hormones and related agents. And then we have next miscellaneous group of drugs, right, then we have what is called as miscellaneous group of drugs. Now let me tell you what are the alkylating agents, what are your platinum compounds, antimetabolites, natural products, hormones and related agents, and as well as the miscellaneous drugs. So first let me take up the alkylating agents. Now let me tell you the alkylating agents first. So if you take the alkylating agents, they include what is called as the nitrogen mustards, right, they include what is called as the nitrogen mustards. The next group what you have is ethyleniamines, right, next group what you have is ethyleniamines. And the next further group you have what is called as alkyl sulfonates, right, next group what you have is the alkyl sulfonates. Next you have the other group of drugs which are called as nitrosoureas, right, nitrosoureas. And the other group what you have is triazines, right, triazines. So these are your alkylating agents which includes nitrogen mustards, ethyleniamines, alkyl sulfonates, nitrosoureas, and as well as the triazines. Now let me tell you what are your nitrogen mustards. You take nitrogen mustards. Nitrogen mustards, they include meclorithamine, it includes cyclophosphamide, ifosfamide, melphalan, and then chlorambucil. That is your nitrogen mustards. Next you have ethyleniamines. Ethyleniamines, if you take, they include thiotepa, they include hexamethylmelamine, and this hexamethylmelamine, this is also called as altritamine. So that they are your ethyleniamines. Next you take alkyl sulfonates. Alkyl sulfonates, they include busulfan. And you take nitrosoureas. Nitrosoureas, they include carmustine, lomustine, and then streptozocin. They are your nitrosoureas. Next you take triazines. Triazines, they include procarbazine, dacarbazine, and then temozolomide. These are your alkylating agents. Now after having discussed about the alkylating agents, next we have what is called as the platinum compounds. So the second group is your platinum compounds. Now if you take this particular platinum compounds, we have only 3 drugs under this particular platinum compounds. Now what are those platinum compounds is? They include cisplatin, Alright, they include cisplatin, and the other drug is carboplatin. Right, the other drug is the carboplatin, and the other drug is oxaliplatin. Right, the other drug is oxaliplatin. So these are your platinum compounds. So after having discussed about the alkylating agents and platinum compounds, next what we have is the antimetabolites. Next we have other group of drugs, they include antimetabolites. Right, the other group of drugs which include antimetabolites. The antimetabolites, they include pyrimidine analogs. Right, they include pyrimidine analogs. The second group of antimetabolite drugs, they include the purine analogs. Right, they include the purine analogs. And the third group we have folic acid analogs. Right, folic acid analogs. So these are the three groups of the antimetabolites. Now you take the pyrimidine analogs. Now if you see the drugs in the pyrimidine analogs, they include 5-fluorouracil, they include cytarabine, and then you have gemcitabine. So these three are your pyrimidine analogs. Next, you take your purine analogs. So if you take the purine analogs, they include 6-mercaptopurine, 6-thioguanine, pentostatin, and then you have cladribine. So these are your purine analogs. Now let me tell you the folic acid analogs. Folic acid analogs, they include methotrexate and then p-methotrexate, that is your folic acid analogs. So this completes your antimetabolites. Next to the antimetabolites, then you have natural products. Right, then you have the natural products. Now let me tell you what are the groups under your natural products. Natural products, they include Vinca alkaloids. Right, natural products, they include Vinca alkaloids. Then you have taxanes, and the other group of drugs what you have is epipodophylotoxins. Right, epipodophylotoxins. And next you have camptothecins. Right, next you have what is called camptothecins. So next to your camptothecins, you have anti-tumor antibiotics. Right, anti-tumor antibiotics. So anti-tumor antibiotics, they are also your natural products. And then you have enzymes. Right, and then you have enzymes. So these are your natural products. Now let me tell you the Vinca alkaloids. The Vinca alkaloids, if you take, they include vincristin, then you have vinblastin, and then you have vinorelbin. They are your Vinca alkaloids. You take taxanes. Right, you take taxanes. Taxanes, they include paclitaxel, and then you have docetaxel. So these are your taxanes. Next, you take your epipodophylotoxins. Right, you take your epipodophylotoxins. So if you take epipodophylotoxins, they include etoposide and as well as teniposide. They are your epipodophylotoxins. Next, you take your camptothecins. Camptothecins, they include topotecan and then irinotecan. That is your camptothecins. Next, you take the anti-tumor antibiotics. Anti-tumor antibiotics. Anti-tumor antibiotics, they include anthracyclines, they include bleomycin, then you have dactinomycin, and then you have mitomycin C. They are your anti-tumor antibiotics. Alright. Next, you take the enzymes. The enzymes which are acting as the antineoplastic drugs, they include L-asparginase. Right? L-asparginase. But in the anti-tumor antibiotics, like we have discussed the anthracyclines. Within the anthracyclines, again you have the various drugs. So if you take anthracyclines we have discussed in the anti-tumor antibiotics. And if you take this particular anthracyclines, right, if you take this anthracyclines, we have various drugs under your anthracyclines. They include daunorubicin, then they include doxorubicin, and then you have epirubicin, then you have idarubicin, and then you have what is called as mitoxantrone. So these are your anthracycline group of the anti-tumor antibiotics. So this completes the natural products which are acting as the antineoplastic drugs. Next, let me tell you the hormones and their related agents which are acting as the antineoplastic drugs. Now let me tell you the hormones and related compounds, right, hormones and related drugs which are acting as the antineoplastic drugs. The first group, if you see, corticosteroids. There are certain corticosteroids which are acting as the antineoplastic drugs. Then you have anti-estrogens, right? Then you have anti-estrogens. Then you have progestins, right? Then you have progestins. Then next to the progestins you have estrogens, right? Next you have estrogens, and next you have the other groups, that is androgens, right? Androgens. And then you have anti-androgens, right? Next you have anti-androgens. Next to the anti-androgens you have GnRH analogs, alright, you have GnRH analogs. Next to the GnRH analogs you have GnRH antagonist. Right, GnRH antagonist. Now let me take up the corticosteroids first. If you take the corticosteroids which are acting as the antineoplastic drugs, they include prednisolone and the other one is prednisone. These are your corticosteroids which are acting as the antineoplastic drugs. Next, you take the anti-estrogens. The anti-estrogens, they include SERMs, that is selective estrogen receptor modulators. Selective estrogen receptor modulators which are acting as antineoplastic drugs, they include tamoxifen and as well as doloxifene. They are your selective estrogen receptor modulators. Next, apart from SERMs, the other anti-estrogen drugs, they include aromatase inhibitors. The aromatase inhibitors, they include aminoglutamide, it includes formistane, and it includes exemestane, and it includes anastrozole, then you have vorozole, then you have letrozole. So these are your aromatase inhibitors which are anti-estrogens acting as antineoplastic drugs. Then you have progestins, right? Then you have progestins. The progestins, it includes medroxyprogesterone acetate, that is your antineoplastic drug which is a progestin. Next, you take the estrogens which are acting as the antineoplastic drugs. They include diethyl stilbestrol and as well as ethinyl estradiol, that is your estrogens. Okay, so that includes diethyl stilbestrol and as well as ethinyl estradiol. They are the estrogens which are your antineoplastic drugs. Next, you take the androgens. So if you take the androgens, it is mainly the testosterone which is an androgen. Next, you take the anti-androgen. The anti-androgens, they include flutamide. Flutamide is the anti-androgen which is acting as an antineoplastic drug. Next, you take the GnRH analogs, right? You take GnRH analogs. GnRH analogs which are acting as antineoplastic drugs, they include leuprolide, goserelin, nafarelin, then buserelin, and then hysterelin. They are your GnRH analogs which are acting as antineoplastic agents. Next, you take the GnRH antagonists, right? GnRH antagonists. GnRH antagonists which are acting as antineoplastic drugs, they include cetorelix, ganirelix, and next you have abarelix. So these are your GnRH antagonists which are the hormones acting as the antineoplastic drugs. So after having discussed about the hormones and related drugs acting as antineoplastic drugs, let me tell you some of the miscellaneous agents which are acting as antineoplastic agents. Now let me tell you what are these miscellaneous agents. Right, let me tell you the miscellaneous agents which are acting as the antineoplastic drugs. The miscellaneous agents, if you take, number one, you have biological response modifiers. Right, biological response modifiers. Then you have the other group of drugs which are nothing but substituted urea. Right, substituted urea. And then we have the other group of drugs which are nothing but adrenal cortex suppressant. Right, adrenal cortex suppressants. And apart from this adrenal cortex suppressants, we have tyrosine kinase inhibitors. Right, tyrosine kinase inhibitors. Then we have the other group of drugs which include retinoids. Right, which includes the retinoids. Then you have arsenic compounds. Right, then you have the arsenic compounds, and next to the arsenic compounds, lastly we have what is called adenosine deaminase inhibitors. Right, adenosine deaminase inhibitors. Now let me tell you the biological response modifiers. Biological response modifiers, they include number one, recombinant interleukin 2. The recombinant interleukin 2, the drug is aldesleukin. Aldesleukin is a recombinant interleukin 2 which is a biological response modifier which is acting as an antineoplastic drug. Then the next you have what is called as GM-CSF, right? That is granulocyte monocyte CSF, that is colony stimulating factor. And the example of GM-CSF, it includes what is called as sargramostim. Sargramostim is a GM-CSF which is a biological response modifier which is acting as an antineoplastic drug. Next, you have what is called GCSF, that is granulocyte colony stimulating factor. If you take the GCSF, that includes filgrastim. Filgrastim is a GCSF which is a biological response modifier which is acting as an antineoplastic drug. Then you have the monoclonal antibodies. The monoclonal antibodies, they include rituximab and as well as trastuzumab. These are the biological response modifiers which are acting as the antineoplastic drugs. Next, you take the substituted urea. Right, you take the substituted urea. The substituted urea, it includes the hydroxyurea. Next, you take the adrenal cortex suppressants. Right, you take the adrenal cortex suppressants. The adrenal cortex suppressants, they include what is called as metotane. Then you have next what is called as the tyrosine kinase inhibitors. The tyrosine kinase inhibitors, they include imatinib, then it includes geftinib, and then it includes what is called as erlotinib. They are your tyrosine kinase inhibitors which are the antineoplastic agents. Next, you take the retinoids. Right, you take the retinoids. Retinoids, if you take, that is isotretinoin which is acting as an antineoplastic agent. Next, you take the arsenic compounds. The arsenic compounds, if you take, it includes arsenic trioxide which is acting as an antineoplastic agent. Next, you take the adenosine deaminase inhibitors. Adenosine deaminase inhibitors, they include pentostatin. Pentostatin is an adenosine deaminase inhibitor which is acting as an antineoplastic agent.